Crohn's disease is a type of inflammatory bowel disease (IBD) that causes chronic inflammation of the gastrointestinal GI tract. It can affect any part of the digestive system, from the mouth to the anus, but it most commonly involves the end of the small intestine ileum and the beginning of the large intestine colon. The inflammation in Crohn's disease can extend through multiple layers of the intestinal wall, leading to a wide range of symptoms and potential complications. Symptoms of Crohn's disease. The symptoms of Crohn's disease can vary greatly from person to person and depend on which part of the digestive tract is affected. Common symptoms include abdominal pain and cramping, often located in the lower right part of the abdomen. Pain can range from mild to severe and may be intermittent or constant. Diarrhea. Chronic diarrhea is a hallmark of Crohn's disease. Diarrhea may contain blood or mucus and can be urgent and frequent. Fatigue. Due to the inflammation, nutrient malabsorption, or the body's response to chronic disease, people often feel weak and tired. Weight loss and malnutrition. Difficulty absorbing nutrients from food can lead to weight loss and malnutrition, even with a normal or increased appetite. Fever. Low-grade fever may occur during active disease flares. Blood in stool. Bleeding from the inflamed areas of the intestines may result in bloody stools. Mouth sores. Ulcers or sores can develop in the mouth or on the gums. Reduced appetite. Nausea, pain, and difficulty eating due to inflammation can lead to a reduced desire to eat. Other symptoms: joint pain, eye inflammation, uveitis, and skin issues like ulcers or rashes can occur as part of the disease's systemic effects. Causes and risk factors. The exact cause of Crohn's disease is not fully understood, but several factors are believed to contribute to its development. Immune system dysfunction. Crohn's disease is thought to result from an inappropriate immune response, where the body's immune system mistakenly attacks the healthy tissues of the GI tract, leading to chronic inflammation. Genetics. There is a genetic component to Crohn's disease. People with a family history of the condition are more likely to develop it. Environmental factors. Smoking is a significant risk factor and can worsen the severity of the disease. Diet, pollution, and exposure to certain bacteria or viruses may also play a role in triggering the disease, though the exact relationship is unclear. Age and gender. Crohn's disease can develop at any age, but it is most often diagnosed in young adults between the ages of 15 and 35. Men and women are equally affected. Diagnosis. There is no single test to diagnose Crohn's disease. The combination of tests and procedures is typically used to confirm the diagnosis and rule out other conditions. Blood tests. To check for signs of inflammation, infection, anemia, or malnutrition. Stool tests. To rule out infections and check for signs of bleeding or inflammation. Endoscopy and colonoscopy. Endoscopy examines the upper part of the digestive tract, while colonoscopy looks at the lower part colon and rectum. Both involve the use of a flexible tube with a camera to visualize the inside of the digestive tract and take biopsies. Imaging tests. CT scans or MRI can help visualize inflammation, strictures, or abscesses in the intestines. Capsule endoscopy involves swallowing a small capsule with a camera that takes images of the small intestine as it passes through, which can detect areas of inflammation or ulceration. Treatment: there is no cure for Crohn's disease, but treatment focuses on reducing inflammation, controlling symptoms, and preventing complications. Treatment often involves a combination of medication, lifestyle changes, and, in some cases, surgery. 1. Medications: anti-inflammatory drugs. Aminosalicylates 5-ASAs are used for mild to moderate cases to reduce inflammation, particularly in the colon. Corticosteroids e.g. prednisone are used to suppress the immune system and quickly reduce inflammation during disease flares but are not for long-term use due to side effects. Immune system suppressors: immunomodulators e.g. azathioprine, methotrexate, and biologic therapies e.g. infliximab, adalimumab help reduce immune system activity and inflammation. Antibiotics used to treat infections or abscesses that may occur due to inflammation. Antidiarrheal medications used to manage diarrhea, a common symptom of Crohn's disease. Pain relievers. Mild pain relievers, like acetaminophen, can be used, but NSAIDs e.g. ibuprofen should generally be avoided as they may worsen symptoms. 2. Dietary changes and nutritional support. Tailored diets. While no specific diet causes or cures Crohn's, certain foods may aggravate symptoms. Patients are often advised to follow a diet that reduces irritation and supports nutrition, such as a low-residue or low-fiber diet during flare UPS. Nutritional supplements. Vitamin and mineral supplements such as vitamin B12, iron, calcium, or vitamin D may be necessary if malabsorption occurs. Enteral nutrition. In some cases, liquid nutritional formulas are used to help the intestines heal and reduce inflammation, especially in children. 3. Surgery. About 70% of people with Crohn's disease will eventually require surgery. Surgery is usually necessary to treat complications such as strictures, narrowing of the intestines, fistulas, abnormal connections between different parts of the intestines or other organs, abscesses, pockets of infection, perforations, holes in the intestinal wall, bowel resection. Removing the damaged portion of the intestines can provide relief, but surgery does not cure Crohn's disease, and the inflammation often recurs. 4. Lifestyle changes. Quit smoking. Smoking worsens Crohn's disease and increases the likelihood of complications and surgery. Stress management. Stress can exacerbate symptoms. Techniques such as yoga, meditation, or counseling can help manage stress and improve overall well-being. Regular follow-up. Ongoing monitoring by healthcare professionals is crucial to adjust treatment as needed and monitor for complications. Complications of Crohn's disease: intestinal obstruction, caused by scar tissue or strictures that block the intestines. Fistulas, abnormal tunnels between the intestines and other organs or skin. Abscesses, pockets of infection that may form within the intestines or other areas of the body. Malnutrition, due to poor absorption of nutrients, particularly in cases where the small intestine is affected. Colon cancer, People with long-standing Crohn's disease have an increased risk of developing colon cancer. Conclusion: Crohn's disease is a chronic, inflammatory condition of the GI tract that requires long-term management. Although there is no cure, with proper medical treatment, lifestyle changes, and, if necessary, surgery, many people with Crohn's disease can live full and productive lives. Managing the condition involves minimizing symptoms, preventing complications, and improving the overall quality of life. Regular follow-up with healthcare providers is essential to monitor the disease and adjust treatment plans as needed.